Thank you very much for coming tonight to hear this very interesting and compelling panel discussion that we're going to have on the topic, is there a financial fix for global health? And we're going to hear from a range of illustrious thinkers who are both scientific academics and policy and politics academics, and I think it's a very compelling and important conversation to have. So let me just start by saying, well, it seems logical to think that if you increase spending on public health, then public health must improve. But the experience on the ground doesn't always match up. And I discovered that firsthand when I went to Botswana in 2008. And I went to Botswana researching for the book on genomics, whose goal or whose premise was that having the blueprint of a human being, the genome, must help us to advance medical research in a profound new way. And I went to Botswana to see how this kind of knowledge was specifically advancing our ability to find new cures for HIV. And Botswana holds the dubious distinction of being the best place in the world to do research on HIV for two reasons. First of all, it has one of the highest infection rates in the world, despite being one of the most progressive countries of Africa. 1/4 of the adult population carries the HIV virus. Unusually in Africa, sub-Saharan Africa, the virus takes its greatest toll on women. The epidemic has been feminised there. 60% of those infected are women. But Botswana is also a great place to study HIV because it was the first place in the world to do a free rollout of antiretroviral medication, thanks to a collaboration between Maersk and the Gates Foundation. So because of those things, Harvard has a lab in Botswana. It's called Harvard Botswana. It's on the grounds of Princess Marina Hospital in the capital, Gaborone. And that's where I went, planning to interview the researchers at Harvard Botswana who were indeed using the information from the human genome to peer into the genome of these people of Botswana to see if the genome might hold some clues as to who would perhaps be a little bit more resistant to the virus, how they were going to respond to drugs, and so on. However, the main lesson I learnt from going to Botswana was not something I learnt at Harvard Botswana. It was what I learnt on my day in the ward in Princess Marina Hospital. So as it happened, I had a friend, Daniel Stefanski, who was one of the specialist registrars in the hospital, one of the few HIV specialists. Daniel Stefanski is a Monash graduate, and I knew him from a mutual friend, Roger Short, and there was another philanthropy connection there. And my day on the wards with Daniel was of course an eye-opener. As I expected, and I certainly girded my loins, it was a confronting experience. But there was one thing I didn't expect, given that Botswana had already had free antiretroviral therapy for 5 years by then. I did not expect to see what I saw, which was wards full of dying people. The men's ward, full of dying people, but at least they were confined to the beds. In the women's ward, they couldn't confine them to the beds. They were on the floors because, as I said before, the number of women infected in sub-Saharan Africa is so much greater than the men. So I had a couple of days still to spend with Daniel following my day in the ward, in which he debriefed me. I was naturally a little perturbed by what I'd seen that day in the ward. And my main question was, Why were the wards full of dying people? You've got free antiretroviral therapy. And what Daniel explained to me was that, yes, they can get free drugs, but only if they know that they need to use them. And in the ideal world, a person goes to a clinic to get their blood tested. And in Botswana, 1 in 4 people will discover they are indeed infected with HIV, but they don't get treated straight away. What happens is they should go back to the clinic every few years to test the levels of their white blood cells, which are the target of this virus. Over the years, the virus destroys the white blood cells, and when the blood cells reach a critical level of 350 white cells per millimetre of blood, then they need to go on treatment. But people simply were not going back to the clinics to get themselves tested. They were only seeking out doctors when they were so terribly ill. They were already at death's door by the time they were admitted to Princess Marina Hospital. So I went to Botswana as a science writer, expecting to come back with great stories of how the new science of genomics was providing new treatments for HIV. Instead, I came back as a devotee of public health, which is an umbrella term for all the mundane stuff that is involved in actually getting treatments to the patients who need it. And as a result of that insight, a year later, we established the Finkel Chair of Public Health at Monash. So this preamble is certainly not to say that we don't need to invest in innovative science, but we also need to invest in effective delivery. And HIV is an excellent example of that. Without the drugs, 22.5 million people in Africa would be facing a death sentence. But we need effective policy and strategy to deliver those drugs. So we're about to be treated to a very enriching discussion tonight from both the scientists who are delivering these innovative technologies and the policy experts. So I will introduce them to you. Professor AJ Mahal is the inaugural holder of the Finkel Chair in Global Health at Monash. He's a very eminent health economist with extensive experience in India, Malaysia, working with the Palestinian Authority, in Bangladesh, Botswana, the Dominican Republic, and Ukraine, which is not to name all of the places where he has worked. He's also been a consultant to the World Bank and the World Health Organization and other government and non-government organizations. Our moderator tonight is Professor Greg Barton. He is the Herb Feith Research Professor for the Study of Indonesia in the Faculty of Arts at Monash. I know a little about Herb Feith from other Australian academics who've been greatly inspired by Herb Feith. I never met him, but I understand him to have been a very charismatic scholar. Greg is Acting Director for the Centre of Islam and the Modern World. He's UNESCO's Deputy Chair in Interreligious and Intercultural Relations in the Asia Pacific, and he's also involved in the Global Terrorism Research Centre. Professor Sharon Lewin is an international leader in HIV research, specifically dealing with finding a cure for HIV. The idea of a cure was something nobody spoke about much until Sharon put it on the radar screen at the 2010 International AIDS Conference, where she was a keynote speaker. Sharon runs a large laboratory and splits her time between doing cutting-edge bench research and seeing patients. She receives funding from Australia's NHMRC, from America's National Institute of Health, the American Foundation of AIDS Research, and other funding bodies. And in 2014, Sharon will co-chair the 20th International AIDS Conference here in Melbourne, an extraordinary coup for Melbourne. The other co-chair is Françoise Bar-Sinoussi, who is the Nobel Prize winner for discovering that HIV is the cause of AIDS. Michelle McIntosh is a senior lecturer at Monash's Faculty of Pharmacy. One of the outstanding things Michelle has recently achieved is that out of 600 proposals presented to the 2011 Global Grand Challenges for Development, hers was selected as the most likely to have a transformational effect in healthcare worldwide. Michelle is working to redesign a drug that will save the lives of thousands of new mothers and their babies in developing countries. Professor Paul Herzog is the director of the Centre for Innate Immunity and Infectious Disease. His research aims to increase our understanding of how this innate immune system, which is the primitive contingent of our immune system, the foot soldiers rather than the intelligent drones, he's focusing on how this contingent is involved in infectious disease, in inflammatory diseases and cancer. And Paul does indeed use the fruits of the genome in his research. And last but not least, we have Inyelwa Ologe, who is currently undertaking his PhD in politics at Monash. He's a research consultant to Oxfam and has authored papers on the human rights implications of South Africa's HIV policy. He also played an active role in drafting a proposed UN Convention for Victims of Abuse of Power. In recognition of his commitment to human rights, he has received several awards, including the Mandela Rhodes Scholarship and a Sir John Monash Medal. That's an illustrious group of speakers, and I would now like to invite them onto the stage. Thank you.